There's been great progress in reducing the number of central line-associated bloodstream infections, 58% according to the CDC. But after meeting with the CEO of the Association for Vascular Access, recent trends show there's still a lot of work that needs to be done in hospitals across the country. With the doors open, hundreds took over the Phoenix Convention Center for the Association for Vascular Access's annual scientific meeting. It was a record attendance, more than 1,500 people, and most of the clinical attendees were not affiliated with the industry, but they were eager for education and innovation in vascular access.
There are two things that people remember when they're hospitalized: how bad the food was and how many times they got stuck. And what you're starting to see with advancements in peripheral IV care and maintenance and the research that goes into it is that you don't need to be stuck a million times. You don't need to have two arms that are blue from having had your veins blown, either unnecessarily because PIVs are being removed prematurely or because people aren't using ultrasound guidance.
Nasrallah says it's exciting to see the industry moving toward listening to the customer's needs, which Ava attributes to fewer readmissions and lower infection rates. But inserting lines still has room for improvement. There are more than 250,000 catheter-related infections each year.
The trend is that peripheral IVs have historically been overlooked as a source of complication and infection. What we've started to see both with research and practice is that they are now being seen as a threat to the patient's condition. We know that this is true both in the research that's been published in places like JAVA, but also in what we see happening in acute care facilities that have implemented bundles and elevated care practices for peripheral IVs.
To help educate clinicians on elevated care practices, Ava introduced the Save That Line campaign, also promoted at their meeting. But new this year is Ava's partnership with Medline to drive standardization and improve patient safety.
And what Medline does, from our perspective, it's half technology, but also consulting within the hospital to help them understand what they could be doing better, what their gaps look like, and how Medline might be able to fill those gaps. And sometimes it's not going to be a product solution, it's going to be a behavior change.
Some of the components that drove attendees to Medline's booth were Erase BSI, which delivers best practices for post-insertion care, and products such as Aegis to help shield the catheter site from bacteria.
It's clear that Medline did significant voice of customer to put together the tools that it's developing and now promoting, and I am very much looking forward to seeing that level of standardization take hold throughout the vascular access continuum.
After 4 days, clinicians walked away with new ideas after talking with colleagues and suppliers about current practices and education. Education is what Ava continues to advocate for as healthcare providers across the country continue to prioritize vascular access. To learn more about standardizing practices, visit Medline.com. For the Medline Newsroom, I'm Marianne Ostrogorski.